Agricultural FFA chapter. My name is Avery.
I'm Rebecca.
I'm Angela.
And I'm Shania. And we are going to be demonstrating today how to give a subcutaneous shot to our little steer Bobo. The product we're using today is Ivomec. Ivomec is a clear, ready-to-use sterile solution. It is an injectable parasiticide, and it is highly effective when used in low dosages. Ivomec can be used to treat for the following parasites: gastrointestinal roundworm, lungworm, grub, sucking lice, and mites. Ivomec can be also used for the following animals: beef cattle, dairy cattle, swine, reindeer, and bison. I will now turn it over to Angela to talk about safety issues.
When injecting Ivomec, you do it subcutaneously, which means under the skin, and usually use a squeeze Okay. And since Bobo's pretty tame and he won't cause much trouble, we don't need to do that. And always make sure your equipment is sterile, and you always sterilize the injection sites.
So there's no risk for any infections.
Yep. And if the cow is going into slaughter in 35 days,
Or if it's a breeding cow,
you shouldn't inject the drug because we don't know the withdrawal time, and we don't want it in a female dairy cow's milk or the slaughtered cow's meat. Now, Shania is going to fill a syringe.
Alright, so the drug we're using today, as Avery said, is Ivomec. And the recommended dosage is 1 milliliter, or cc, for every 110 pounds. And today, our steer Bobo is a hefty 990 pounds. So we're going to be using 9 cc's. And the syringe I chose to use is a 20 cc syringe. And as you see, we also have many other options. We have a 3 cc, or we even have up to 60. And the needle size, as recommended, is a 16 gauge, 3/4 inch long needle. And you would use a longer needle if you were going to do intramuscular or intravenous. But since it's just going to be under the skin, a shorter one is acceptable. And the first step in this is going to be writing my patient's name and all the information down. So it's going to be Bobo. We're giving him Ivomec today, 9 cc's. And today is April 10th, 2014. And I'll go ahead and initial that. And the first step is going to be removing the cap and making sure that we disinfect it with a clean alcohol swab. And then I'll place this upside down, remove the needle, or the cap from the needle. And then always be sure that you get more in your syringe than you actually need, because it's easier to just go ahead and push that out and make sure you have the correct amount. And then I will remove that. Be sure that there is no air in the needle. And then recap it. And I'll go ahead and pass this to Rebecca, and she will show us how to properly give the dose.
Alright, so when it comes to cattle, there's two places where you can administer the shot. There's the neck or the shoulder. Now when it comes to swine or dogs or cats, you use the neck because that's where the loose skin is. And subcutaneous, it's going to disperse the slowest that way. The next fastest way would be to inject it into a muscle, and then the fastest way is to inject it into a vein. But we want it to disperse slowly, so we're going to administer it subcutaneously. So first we're going to take the skin like this so it forms a triangle, and then we're going to disinfect it. And then after we disinfect it, we're going to place the needle in there and then release the skin. And then make sure you aspirate, so you're going to pull back. And if there's blood, you just redirect the needle, but there's no blood, so we can go ahead and push that in. And then you can go ahead and remove the needle and just run them right there. Good boy, Bobo.
praise the animal. That's an important part after administering the shot.
And after that, we'll just take the needle off and place it into the shark's container.
And that is how you properly administer a subcutaneous shot to a steer. Any questions?